Hello, welcome to this video. My name is Christiana Amausisayra. I'm a public health practitioner. In this video, I would like to talk about the 6 main complications of high blood pressure or hypertension. Now, if somebody is diagnosed with high blood pressure or hypertension, what it means is that the force of the circulating blood that is pushing against the walls of their artery or their blood vessel is consistently high, and it also means that the heart is working harder to pump blood, and that is not healthy. It has to be managed. So if you have already been diagnosed with hypertension and you don't take your medication, you think it's play, you don't take your medication serious, you don't take the dietary changes serious, you are just there, these are the complications that could happen if your blood pressure remains uncontrolled for a long time or over a period of time. The first complication is that it could lead to heart attack or a stroke. Now, over a period of time, if your blood pressure is not well controlled, your arteries become hardened and narrowed. And when this happens, it could reduce blood supply to the brain and the heart itself. And the high blood pressure, in addition to other factors such as high bad fat or high cholesterol in your body, this could lead to the bad cholesterol clogging your arteries or blocking your arteries, so it causes narrowing. So this could reduce blood supply. For example, if this happens in the coronary artery, which is the artery or the vessel that supplies blood and nutrients to the heart itself, it means that the part of the heart that this artery is supposed to supply, the narrowed artery is supposed to supply, will be deprived of blood. So this could lead to, the part of the muscle dying, the heart muscle dying. And this is when we say the person has heart attack. And if you do not receive prompt care within, minutes, you could die. Then the stroke is when, the same situation happens to your brain. So whether there is a ruptured blood vessel due to the high blood pressure, so it causes bleeding in the brain, and this puts pressure on the brain and affects, it deprives the part of the brain that is supposed to be supplied by the artery. So it deprives it of oxygen and nutrients. That could cause a stroke. Another way is that if the arteries are hardened, if they are hardened, maybe as a result of fat depositing in them, thereby reducing blood flow to the brain, that will also cause stroke. So we have 2 types of stroke: the ischemic stroke, where there is reduced blood supply, and then as a result of blockage or narrowing, and then the hemorrhagic stroke, where there is only rupture, weakening, bulging of the artery due to the high pressure of the blood that is flowing through it, and then it ruptures. So hemorrhagic stroke. So you see why you should take your medications seriously, take your dietary changes seriously, avoid a lot of salt, and so many other changes that you have to make. In fact, prevention is the best. So you can prevent high blood pressure now. The second one is heart failure. And heart failure is when the heart is unable to pump blood effectively to the rest of the body. And how will this occur? Over a period of time, the arteries become hardened due to the consistently high blood pressure. And what happens is that because there is resistance, the heart will have to be struggling to pump blood through these arteries. Over a period of time, the heart's pumping chamber, which is known as the left ventricle, becomes thickened and enlarged, and this renders it unable to contract effectively to pump blood to the rest of the body. And this condition is known as left ventricular hypertrophy. So if this happens, it means the heart is failing, and if the heart fails, that is death right there. Then the third point is changes in your memory and understanding. Yes, especially when there's reduced blood supply to the brain, it can slow down the brain, slow the brain function, and cause reduce or inability to think, remember or understand things. You can even it's even difficult to learn. So there can be inability to learn due to the effect of high blood pressure on your brain. Then okay, so that's 3: heart attack, stroke, and then heart failure. I've mentioned changes in the brain. So the next one is kidney problems. The high blood pressure damages the vessels in the kidney, it weakens them or makes them hard. So that will cause kidney damage. Then the next one, the 5th one, is eye problems. So it can cause, it can tear the vessels, the arteries in your eyes. It can also cause, your eyes to. It can also cause the arteries in your eye to harden. So thereby, reducing blood flow. And when the arteries in the eye tear, it means there will be bleeding into the eye. And when this happens, it can, obstruct your vision, and it can lead to, a complete or, either partial or complete blindness. So it's very important. Then the last one, the 6th one, is metabolic syndrome. And metabolic syndrome simply refers to a group of disorders that, affect your body's metabolism. It involves, irregular breakdown of glucose or sugar in your body. So the syndrome includes increased waist size, increased blood sugar, increased bad cholesterol or the low density lipoprotein, which is also known as LDL. Then reduction in your good cholesterol, which is known as the high density lipoprotein. And all these are precursors for diabetes mellitus or type 2 diabetes. So this is why some people who have been diagnosed with hypertension, over a period of time, if their BP is not well controlled, they develop diabetes as well. And it has its own complications. So please, high blood pressure is not something to joke with. It's a serious issue, and you should, adhere to your medical appointment and, everything. Take your prescribed medication. Very, very important, so that you do not get these complications. So please, I'll go over the complications quickly. I mentioned heart attack or stroke or both. You can also get a heart failure. You can also get it could cause changes in your memory and understanding. In fact, it can also cause a type of dementia that is known as a vascular dementia. And this occurs due to the narrowing of the vessels that supply blood, oxygen, and nutrients to your brain. So it causes, decrease in brain function, so and memory loss. Okay. Then I mentioned eye problems, kidney problems, and so heart failure, heart attack, stroke, eye problem, kidney failure, changes in your memory. All this can occur as a result of, uncontrolled high blood pressure or uncontrolled blood pressure. So please adhere to your lifestyle changes to make sure your blood pressure is kept under control. Thank you, and please watch out for more videos. Bye.